Welcome to this explainer. Today, we're diving into a genuinely watershed moment in global public health, the 1978 Declaration of Alma Ata. We're going to take a credible academic look at this because it isn't just an old piece of paper. It's a historical document that literally shifted the entire paradigm of how we view global health. So let's get right into it. Back in 1978, the World Health Organization and UNICEF organized this massive international conference in Alma Ata. And what came out of it? A completely urgent call to action. They were essentially putting all governments and the global community on notice. It's time to step up, protect, and promote the health of all people. Let's look at Section 1, the right to health, and identifying the core problem. Right out of the gate, the Declaration explicitly states something huge. Health is a fundamental human right. The authors made it clear that the gross inequalities in health status between developed and developing nations, absolutely unacceptable, politically, socially, and economically. And they defined health as not just the absence of disease, but a state of complete physical, mental, and social well-being. Moving on to Section 2, defining primary health care as a structural solution. So the major target here was attaining an acceptable level of health for everyone by the year 2000. And the key to unlocking that? Primary health care, or PHC. They defined it as essential health care that's practically and scientifically sound. But vitally, it has to be universally accessible, and at a cost the community can actually afford. It's designed to be that very first level of contact between an individual and the national health system. Now, the scope of this goes way beyond just hospitals. It requires a really comprehensive, multi-sectoral approach. We're talking about health education, proper nutrition, safe water and basic sanitation, maternal and child health, even family planning. Throw in immunizations, controlling endemic diseases, treating common illnesses, and providing essential drugs. Together, all these components provide promotive, preventive, curative, and rehabilitative services in one package. Which brings us to Section 3, community power, and how to actually sustain the system. Okay, this is perhaps the most revolutionary concept in the entire document. The Declaration mandated a complete pivot from top-down government mandates to bottom-up community empowerment. They argued that maximum community self-reliance and participation are absolutely non-negotiable. Basically, people have both the right and the duty to participate in the planning and implementation of their own healthcare. That is the only way this whole thing becomes sustainable. And finally, Section 4, a global call to action, focused on collaborating globally. The text also makes a highly provocative point about resources. It draws this sharp contrast between the immense global resources currently spent on armaments and military conflicts versus what could happen if those funds were reallocated. The argument here is that a genuine policy of peace and disarmament could release the exact resources needed to actually fund primary health care and drive broader social development. So, consider the world today. The Declaration of Alma Ata set this sweeping, ambitious mandate for global health equality. But decades later, when we look at modern health systems and those ongoing disparities, we really have to ask ourselves, have we truly fulfilled this 1978 vision of health for all? Well, I hope this explainer has given you a powerful new perspective on the foundations of global public health.